Today on the show, the impact of a secure housing program on patients and the care team. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Over a decade ago, the team at Montefiore Health System noticed that patients who were homeless or at risk of losing their homes needed a more comprehensive support system. That led to the development of the Housing at Risk Program, or HARP, which works to improve patient outcomes by prioritizing continuity of care. Deirdre Sekulic is a licensed social worker and the Associate Director of Social Work at Montefiore.
So the Housing at Risk program was established back in March 2009 at Montefiore. And at that time, we were noticing a high influx of people that were either homeless, street or shelter homeless, coming into our emergency rooms, getting admitted into the hospital, and kind of getting stuck in the hospital. At that time, the Department of Homeless Services in New York City had a paper application. Their referral procedure was very outdated. It's much, much better now. And so we noticed that it could take somebody that got hospitalized probably weeks to months for DHS to approve to send to shelter. So we would have people stuck into the hospital for long periods of time that weren't medically necessary stays. They were already medically cleared. We would send them down to shelter, discharge them to shelter, and sometimes they would go or they wouldn't go, and then they would end up back in the hospital. So we had this revolving door of people with issues with housing in and out of the emergency room, in and out of the hospital. And we started looking at, their care also, because we were concerned with people getting stuck unnecessarily in the hospital. But we were at the same time also very concerned with their utilization of emergency room services for very episodic cases. So there was no continuity of care. So we really wanted to focus on kind of coordinating health and housing and putting in a support system to manage those patients better, get them linked to primary care so they would have better health outcomes, and to also improve the flow of people into the emergency room and into the hospital.
This is clearly an important program. Tell us more about its impact on patients.
The impact, I think over the last 16 years that we've had that program, we've kind of developed it and grown and we've evolved from looking at people who are strictly street and shelter homeless to people that are at risk of eviction. And that led us into people with chronic diseases, and specifically within our oncology department. Before I ran this program, I was actually an oncology social worker. So I was very aware of when somebody gets a chronic illness, especially if they're head of household and they're the one supporting the family or paying the rent, and they get a chronic illness. And now the whole family is kind of destabilized. We wanted to look at in Montefiore to kind of move things, as forward and early on in somebody's diagnosis. So we wanted to have a dedicated team that would educate providers throughout the hospital system to say, hey, if you have somebody with a chronic illness or if you have somebody with a need, there's a potential for them to become unstably housed. And if we start to work earlier on with these patients, we can better affect their, compliance with treatment, their health outcomes. If somebody is in an unstable housing environment or has to end up in a shelter system, it's going to have an outcome on their health. We've seen that since developing the program, we have patients who just have better health outcomes, who are more adherent to treatment. But we also see with our providers that there's a decrease in kind of the moral distress with having to work with somebody who has a housing issue. In the past, before we had this program, providers would hear from their patients about issues and kind of felt, that there was nothing they could offer. Housing is a very complex system. So what we found is in getting referrals from providers and being able to, resolve a housing issue or improve a housing issue, going back to those providers and say, hey, that referral that you sent us, we were able to fix their housing, has a profound effect on the providers because they feel they're part of that journey. They were part of that solution to that patient. And because of their referral and because of them asking those questions and treating the patient holistically, that the patient had a much better outcome. So we really noticed that with providers too, that it's not just the patients that are benefiting from this program, it's definitely, all of the clinical staff and the providers.
What do you want listeners to take away from our conversation today?
I think housing, like I said many times, is complex. And I think never to be afraid to ask people about their housing situation or to probe a little bit, and to do it in kind of a dignified way where we're always maintaining the dignity of the person, because there's a lot of shame attached to housing issues and to homelessness, and to ask them that in a very dignified manner, but to make sure to ask the question. That's kind of the beauty of this program. You don't have to have the answer as a clinician. You just know that you can ask that question. And if you find out the information, you can transfer that patient over to our housing team and we will take care of the rest. But I would say to make sure we're really talking to patients and getting a good idea of all of their needs.
Thank you, Deirdre. You can click on the resources in the show notes for more on addressing housing insecurity. Thank you for listening. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.